Headaches can be more complicated than most people realize. Different kinds can have their own set of symptoms, happen for unique reasons, and need different treatments. There are over 150 types of headaches, but the most common types include Number 1. Tension headaches. Tension headaches are the most common type of headache among adults and teens. They cause mild to moderate pain and come and go over time. They usually have no other symptoms. Number 2. Migraine headaches. Migraine headaches are often described as pounding, throbbing pain. They can last from 4 hours to 3 days and usually happen 1 to 4 times a month. Its symptoms are sensitivity to light, noise or smell, nausea or vomiting, loss of appetite, and upset stomach or belly pain. The patient may look pale, feel dizzy, and have blurry vision, fever, and an upset stomach. Number 3. Cluster headaches. These headaches are the most severe. You could have intense burning or piercing pain behind your or around one eye. It can be throbbing or constant. The pain can be so bad that most people with cluster headaches can't sit still and will often pace during an attack. On the side of the pain, the eyelid drops, the eye reddens, the pupil gets smaller, or the eye makes tears. The nostril on the other side runs or stuff up. You might get them 1 to 3 times per day. Each headache attacks last 15 minutes to 3 hours. They can wake you up from sleep. The headaches may disappear completely. Men are 3 to 4 times more likely to get than women. Number 4. Chronic daily headaches. You have this type of headache 15 days or more than a month for longer than 3 months. Some are short, others last more than 4 hours. It's usually one of the 4 types of primary headaches. Chronic migraine, chronic tension headache, new daily persistent headache, Hemi, Crania, Continua. Number 5. Sinus headache. With sinus headaches, you feel a deep and constant pain in your cheekbones, forehead, or on the bridge of your nose. They happen when cavities in your head, called sinuses, get inflamed. The pain usually comes along with other sinus problems like a runny nose, fullness in the ears, fever, and a swollen face. The gunk that comes out of your nose will be yellow or green, unlike the clear discharge in cluster or migraine headaches. Number 6. Post-traumatic headaches. Post-traumatic stress headaches usually start 2 to 3 days after a head injury. You'll feel a dull ache that gets worse from time to time. Vertigo, lightness, trouble concentrating, memory problems, tiring quickly, irritability. Headaches may last for a few months, but if it doesn't get better within a couple of weeks, call your doctor. Number 7. Exercise headaches. When you are active, the muscle in your head, neck, and scalp need more blood. Your blood vessels swell to supply them. The result is a pulsing pain on both sides of your head that can last anywhere from 5 minutes to 48 hours. It usually hits while you are active or just afterwards, whether the activity is exercise or sex. Number 8. Hemicrania Continua. Hemicrania Continua is a chronic ongoing headache that almost always affects the same side of your face and head. Other symptoms include pain that varies in severity, red or teary eyes, runny or stuffy nose, droppy eyelid, contracted iris, response to the pain medication, indomethacin, worse pains with physical activity, worse pain with drinking alcohol. Number 9. Hormone headaches. You can get headaches from shifting hormone levels during your periods, pregnancy, and menopause. The hormone changes from birth control pills and hormone replacement therapy can also trigger headaches. When they happen 2 days before your periods or in the first 3 days after it starts, they are called menstrual migraines. Number 10. Newly daily persistent headaches, NDPH. These may start suddenly and can go on for 3 months or longer. Many people clearly remember the day their pain began. Some people find that it strikes after an infection, flu-like illness, surgery, or stressful event. The pain tends to be moderate, but for some people it's severe. And it's often hard to treat. Symptoms for migraine such as nausea or sensitivity to light. Number 11. Rebound headaches. You might also hear these called medication overuse headaches if you use a prescription or over-the-counter pain reliever more than 2 or 3 times a week or more than 10 days a month. When the meds wear off, the pain comes back and you have to take more to stop it. They can cause a dull, constant headache that often worse in the morning. Number 12. Ice pick headaches. These short, stabbing, intense headaches usually only last a few seconds. They might happen a few times a day at most. If you have one, see the doctor. Ice pick headaches can be a condition on their own, or they can be a symptom of something else. Number 13. Spinal headaches. Talk to your doctor if you get a headache after you have a spinal tap, a spinal block, or an epidural. It is called puncture headache because these procedures involve piercing and membranes that surround your spinal cord. If spinal fluid leaks through the puncture site, it can cause a headache. Number 14. Thunderclap headaches. People often call this the worst headache of the life. It comes suddenly out of nowhere and peaks quickly. Causes of thunderclap headaches include blood vessel tear, rupture or blockage, head injury, hemorrhagic stroke from a ruptured blood vessels in your brain, ischemic stroke from a blocked blood vessel in your brain, narrowed blood vessels surrounding the brain, inflamed blood vessels, blood pressure changes in late pregnancy. Take a sudden new headache seriously. It's often the only warning sign you get of a serious problem. The cares and curiosity want you and those close to you to live a healthy, happy life. Your health is a valuable thing. Look after your health and your mind so that you can live your life to the fullest. Remember, you only get one. Please share this with your friends and family and do let us know what do you think in the comments below. This video is solely for informational purpose. Do not self-diagnose or self-medicate, and in all cases consult a certified healthcare professional before using any information presented in this video. The editorial report does not guarantee any result and does not bear any responsibility for any harm that may result from using the information provided in this video.